Hi everyone and welcome back to Ask Me Doctor. Now today we're talking about the critical role of genetic testing in detecting lysosomal storage disorders, or also known as LSDs, early. And to guide us through this topic, we have once again with us Dr. Ngu Lock Hock, Department Head of Genetics, Clinical Geneticist and Pediatrician, Hospital Kuala Lumpur. Dr. Ngu, thank you so much once again for joining us on the show.
Thank you for having me back.
Most welcome. We're so excited to get started on today's topic and talk about managing lysosomal storage disorders. So Dr. Ngu, let's get started, shall we?
Yeah.
Alright, so can you enlighten parents out there and caregivers who are tuning in how early diagnosis, why it's so important and when it comes to diagnosing LSDs?
So if we can recall our previous episode, all the LSD, they are genetic condition. Means that to confirm the diagnosis, we need certain type of genetic testing. We can check the metabolite, urine, to look for the waste material. We can check the lysosomal enzyme in the blood cell, usually in the blood cell, or we can check the genetic, the gene, whether there's a mistake in the gene. So to do the enzyme study, enzyme testing, we can collect what I call dry blood spot. It's something like this. This is a card. Here there's a small piece of filter paper. There's a circle here. So we just drop a few drops of blood here and dry it. Then we can send it to the laboratory. They can check the enzyme activity by analyzing the dry blood spot.
I see.
So it's very convenient.
Very
easy.
Yeah,
it's very easy to collect, very easy to send.
I see.
We can also do what I call check the DNA. To do this DNA test, you need a sample where you can extract the DNA. It can be a blood sample that you can collect in a tube like this. You can collect the blood. So from blood cell, you can extract the DNA to do the DNA test. Or some of you may be fearful of blood taking. You can have a painless alternative where you can use a swab like this, or you can swab the inner cheek.
So would you say that time is of the essence when it comes to determining whether somebody is a carrier of LSDs?
Yeah, that is absolutely correct, because the early treatment is more effective. Means that if you start this enzyme replacement therapy at the early stage of the disease, before it progresses, become more complication.
So let's move on. Now, earlier you mentioned about genetic testing as a way to diagnose LSDs. So if somebody comes up as positive for LSD, should their family members also get tested?
Okay. So to answer this question, first we need to understand the inheritance of this LSD. There's two types of inheritance here. When you're talking about LSD, one is what we call autosomal recessive, and the other one is X-linked recessive. What do we mean by autosomal recessive inheritance? In this case, both parents, they are carrier.
Right.
So for this gene, normally we have two copies. One we get from our father, one we get from our mother.
Yes.
So each of us have two copies. So carrier means one of the copy is faulty, but carrier has no symptom because you have one backup.
Oh.
You have one normal copy to back up. So you still have the correct instruction for the cell to make the enzyme. So carrier has no symptom and they are silent. But when carrier marry another carrier, there is a possibility that both parents may pass on the faulty copy to the child. So if the child receives both faulty copy from the parent, then there is no correct instruction for the cell to make the enzyme. So in this case, the child will be affected by LSD.
I see.
Once we make the diagnosis of this child having LSD, so routinely we will offer to test the parent to make sure to verify they are truly carrier. So if they are carrier, there is a risk of recurrence in their subsequent pregnancy. We will provide them with genetic counseling to explain to them what I had just explained. Okay, what is the basis of all this inheritance and what they can do. So, some of the options include what I call prenatal diagnosis. Means that when the mother get pregnant again at 12 weeks to 16 weeks of the gestation, they can ask a gynae to take out some fluid or tissue from the fetus. Then we can run the genetic test to see whether this child, this fetus, had a similar disease or not. If the fetus carry the similar faulty gene, then there's an option of what I call termination of pregnancy. So That's one option. The other option is what I call pre-implantation genetic diagnosis. In this case, it involves IVF. That is some of the options available.
And I think that's why it's also very critical for parents who suspect that they have this to undergo this genetic testing to prevent any unnecessary or unwanted
Yeah, you are
issues.
absolutely right, because LSD, even though there's a treatment, it still have a lifelong process.
Thank you, Dr. Ngu. So let's move forward. So what can parents do if they notice that symptoms or suspect that something might be wrong?
Okay, so if the child does show some of the signs and symptoms that may suggest this is LSD, I think the first step to get a medical consultation. It can be a GP, it can be a general pediatrician. They can do a detailed examinations to see whether sign or symptom is consistent or is it highly suspicious of LSD. Of course, if this is highly suggestive, then the next step will be doing the genetic test that we have mentioned about in the beginning.
Now, Dr. Ngu, we've spoken about genetic testing, and I know it can be quite intimidating to some families. What would you say to families who might feel hesitant about doing these tests?
First, for the child, for the affected child, it's very important we make the early and correct diagnosis.
Right.
Because you don't want to miss the critical period that effective treatment is available.
Right.
And each LSD, the product, the enzyme that involved is different. But different type of LSD, the enzyme is different. The treatment's product is different. That's for the child. The second, for the parent, for the family, taking care of a child with LSD is already a difficult task. Having more, even I think more difficult for the family. It's good that you need this genetic testing to confirm you are indeed a carrier, so that you can carry out certain prevention, just as we had mentioned earlier.
And as you mentioned, it's not a painful process at all. It's actually a very simple method to get the results. And I think that's something a lot of parents out there should know and should not feel hesitant towards being a reason why you don't want to do the test, because it's a very painless procedure. So Dr. Ngu, can you share with us, maybe based on your experience, some success stories that can highlight how early diagnosis has the ability to change lives?
You are absolutely right, Mahira, because some of these LSD, there is a treatment available in form of what I call enzyme replacement therapy. This is where you replace the missing enzyme in the lysosome to an intravenous infusion. So we have this little book here, which is published by Malaysian Lysosomal Disease Association, document their member story, their life story.
So
a lot of them,
all patients who have undergone these treatments.
Yes, you are right.
And I think it's very hopeful, and it just goes to show how important the early treatment and intervention is to ensure that the people who have this rare genetic disorder can go on to live healthy and fruitful lives independently.
Yeah, that is absolutely right.
And I think it's a real positive reinforcements for parents out there as well who might be going through this phase as we're speaking. Don't you think so, Dr. Ngu?
Yeah, there's a light at the end of the tunnel.
Very well said. And if you're a parent, a caregiver, or even someone that you know who might notice these symptoms and signs in their children, take that first step. Talk to a doctor, ask about genetic testing, and learn more about how early screening and family screening. So just as we had the conversation with Doctor, these tests are very painless and very easy to do. So take the first step, go through it, don't be scared. And don't stop there, share this video with friends and family. Together we can raise awareness and ensure that every child has the chance for early diagnosis and care. This segment is brought to you by Sanofi Malaysia. For families affected by LSDs, the Malaysian Lysosomal Diseases Association, also known as MLDA, provides vital resources from educational materials to connect parents and caregivers with expert guidance and support group. By raising awareness and fostering a community of understanding, MLDA plays a crucial role in improving the lives of those navigating these rare conditions. Parents can learn more about their work and access valuable information at www.mymlda.com, or you can follow their updates and initiatives on Facebook at facebook.com/MLDA. Thank you so much for tuning in with us till the very end. I'm your host, Mahira Khan.
I am Dr. Ngu.
And this episode has been brought to you by motherhood.com.my.
Bye.